One Health refers to the area of overlap between human health, animal health, and environmental health. And a lot of the problems that we face today are really complex, and they involve ecological issues as well as what's happening with wildlife, with livestock, with human health. And so One Health really seeks to address all of those simultaneously to better answer those problems. Take the pandemic we're facing right now as an example. COVID-19 is a zoonotic disease with an origin in bat populations in China. And to really prevent diseases like this, we have to understand the ecology of the wildlife reservoir, of the bats in this case. We have to understand the ecology of how people and these animals interact. How does the virus get from the wildlife into people? And then once it gets into humans, how does it spread between people and other people? How does it spread back to wildlife? How do we understand that transmission, and what effect does that have on the future of this and other pandemics? The One Health approach allows us to tackle problems that are practical problems, applied problems. If we take Arizona as an example, we sit here on the border between the United States and Mexico. We sit in an area that is an arid landscape. We sit in an area that has a lot of productive agriculture, yet has a lot of pollution problems. We can better understand how to tackle climate change, how to deal with droughts, how to deal with fires increasing. We can look at health in a border community. We can understand better how to promote the health of vulnerable populations. All of these things, disease surveillance, looking at stopping diseases before they become of a pandemic scale. These are the kinds of things where there's practical importance to a One Health approach. It's an exciting time to be in the area of One Health because it's a time when we're able to take people who are in the biomedical sciences and agricultural sciences, even as far afield as computer science, psychology, and law, to address these major issues that we're facing today.